Hello, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about different options for wound closure with the knee replacement surgery. Look at the pros and cons of some of the different options and what are the things to expect with each. Everyone, so today we're talking about different strategies for wound closure. What is basically used to close off that incision that is made for your knee replacement surgery. And so there's basically four main options we're going to look at. So there's staples, there's the glue, there's stitches, and then there's this relatively new technique called the zip stitch. So let's talk a little bit about the pros and cons of each of those. So first we'll talk about staples. So first of all, from an aesthetic and a looks point of view, people talk about the staples can sometimes leave little hash marks along your wound, along your incision, and it almost makes the scar look like a little railroad track. This usually fades over time and is not terrible, but some people do complain of this, so it's something to keep in mind. For the approximation or the closure of the wound when it comes to the staples, this typically takes about 7 to 10 days. So if you're thinking about when you're able to take a shower or a bath, thinking in that ballpark of 7 to 10 days, might be a little bit sooner, might be a little bit later, depending on your surgeon's recommendations. But typically, if you have staples to close the incision, you want to think about in that time frame. Another thing with the staples is you have to have an appointment to remove them. So setting up an appointment either to go into the doctor's office or having someone come to your home to get them removed, something to keep in mind. Another complaint sometimes with the staples is when it comes to really bending and working on your bending of the knee. It can really be uncomfortable and almost feel like this pulling sensation, and it feels almost like the staples are going to pop right out. So that's something to keep in mind as well. When you're doing those exercises early on, might be a little bit uncomfortable. A positive of the staples is it's a very easy technique, and it's a very easy way and quick way to close off the wound, close off the incision during surgery. So if you are someone that the surgeon might feel that there's some more risks, doesn't want to have you under anesthesia, doesn't want to have you in surgery for very long, for as little as needed, they might utilize the staples just because of the ease and quickness of performing that technique to close off the incision. We'll talk about the glue now a little bit. So the glue is supposedly a little bit better aesthetically, better looks. Doesn't have those hashtag marks to worry about. Just like with the staples, it's going to fade over time. The scar is going to be less and less visible, hopefully. So for the glue technique, what it is basically for the deeper tissues, so the muscles and the tendons and the things deeper down, you actually have to use dissolvable stitches to close up that area. And then that skin and that superficial layer, you'll use the dissolvable, you'll use the glue to close it off the superficial layer. And the good thing with the glue is obviously you don't need to make an appointment to have anything removed like you do for the staples. With the glue technique, it typically is 2 to 3 days before you're able to shower, so a little bit quicker with the staples usually. Some other things to think about is that the glue supposedly might decrease your risk of infections. One theory behind this is with the staples and with the stitches, you're making many little punctures through your skin, and that's just a bunch of very little tiny openings that introduce possibility of having infection and having things come into those little punctures. With the glue, you obviously don't have those small punctures throughout the skin, so supposedly it might help decrease the risk and the risk of infections to your skin and to the incision. Some other things to think about is it's a relatively quick technique, the glue. Probably not as quick as the staples, I don't know that for sure, but relatively quick. So not something that's going to take a very, very long time to be during the surgery to do. It does cost more money overall. Some people might have allergic reactions to the glue, to the material, to the substance. Some things as well as is that if you're someone who is at a higher risk for your wound and incision healing at a slower rate, so for example, if you're someone who has diabetes, this isn't advocated for just because we want to make sure that that wound and incision approximates and heals timely and is protected. So for people who have some comorbidities, who might not be able to heal as fast as normal as other individuals, they might not want to recommend using the glue strategy for closing off that incision. The next thing we'll talk about is the stitches. So these are going to be dissolvable stitches, so you don't have to have an appointment to get them removed. They create a relatively clean closure approximation of the skin. There is the tendency every now and then, similar to the staples, to have those little railroad marks. You also might have a bit of a bulge to your scar people talk about. Again, this kind of decreases and goes away over time, but something to think about aesthetically a little bit. There is a little bit more risk of infection, and it also takes a little bit longer to stitch up the incision compared to, say, the staples or using the glue technique. And then the last one we'll talk about is the zip tie stitch. So basically what this is there are very tiny little zip ties, just like a zip tie that you think of from a store or from whatever. These little zip ties go across the incision. So they cross the incision all the way up and down it. And then on the sides, longitudinally on each side of your incision, they put a large strip or a long strip of adhesive tape that holds the zip ties there. And some of the things with this is it's very open, so it's very easy to monitor it and to look at the scar and look at the incision and look that everything's healing appropriately. It's also very painless to remove. So the zip ties actually aren't in the skin, they're connected with the adhesive tape. So to remove them, basically all you do is you pull off the adhesive tape on each side of the incision. They're also good because you can adjust the tension of the zip ties. So if you want to make it tighter to help approximate and close the wound better, you can make it tighter, and you can also make it a little bit looser. And it supposedly and hopefully is supposed to be less scarring, a little bit better look cosmetically than some of the traditional methods, and it's supposedly and marketed as being a lot stronger as well. So maybe a lot stronger, a lot more stable than some of the other techniques. So those are the main 4 techniques. At the end of the day, it's really comes down to what your surgeon's preference is, what they're comfortable with. That's probably going to be the best strategy with all of them. If you're thinking about cosmetically, your scar in the vast majority of cases, it's going to kind of decrease. It's going to get less visible over time, but obviously still a little bit visible, but less and less visible over time, probably with all of the techniques. So probably that should be lower on your considerations. You really want to look at what's the safest, what's the best technique, what shows the most positive results and outcomes. So really it comes down to talking over with your surgeon and what your surgeon is comfortable with and comfortable with using with you and your knee. Okay, so thank you very much for watching, everyone. This has been the Need to Know Show. Again, I encourage you to subscribe. I post a video every day of everything related to knee replacement, surgery, preparation, the surgery itself, and recovery afterwards. Thank you.